Now? Okay, there we are. So I'm Brett Chase. I'm with the Chicago Sun-Times. And I think we're introduced Laura Carroll from FDA, Ruby Ferguson, the City of Chicago, and the Food Depository, and the great Ertharin cousin. If you don't mind, I'd like you just real quick, just tell us who you are and what you do.
Hi all, so I am Laura Carroll. As was said, I'm Senior Advisor to the Chief of Staff at FDA. FDA is one of those 20 agencies that Kat was talking about earlier today that it was part of the national strategy.
Yeah, good afternoon, everyone. I'm Ruby Ferguson, and yes, my role is confusing. I am an employee of the Food Depository detailed to the Mayor's Office, and I staff Chicago's Food Equity Council.
Good afternoon, everyone. My name is Ertharin Cousin. Was referred to as Ambassador Ertharin Cousin because I served as the U.S. Ambassador for Food and Agriculture, representing the United States on all food and agriculture-related issues. I also served as the Executive Director of the United Nations World Food Program. When I came back home, I started an organization called Food Systems for the Future, and we were initially focused on building international food systems through creating businesses that could provide access to more nutritious food. And I got called out by a young woman in Chicago who said, that's all good for what you're doing over there. What are you doing to bring food here home, to ensure that we have access to affordable, nutritious food in the United States? So we are now launching a Food is Health Fund here in the United States that you'll hear more about in the coming months.
So we're here to talk about public-private partnership. And so Rudy, this perfect opportunity to tell us what you've been doing. It was almost 2 years ago that you were announced as the first food equity policy lead for the city of Chicago. So tell us what you're doing and what that means.
Yeah, and actually it's 2 years today, which is really crazy to be full circle. But in 2020, I think there were eyes on our food system as a country across the world in a way that there hadn't been in a while. These had been issues that had persisted for a long time, but it was an opportunity for food leaders to take a step back and think long term of how can we not continue to react and how can we start to think proactively about transforming Chicago's food system. And so they took existing plans that have already been made for Chicago. I think we've all participated in some form of community planning and then are curious what happens with it after you provide all of that feedback. And walked through different pillars of the food system, which led to the development of Chicago's food equity agenda. So there are 5 priorities of the food equity agenda, and then 2 years ago today, I started with the bold task of taking that agenda and working with those ad hoc work group members and transforming that into a council with work groups and that are moving those priorities with transparency and accountability. So we have 4 working groups across the food system, one in nutrition programs that's really thinking about how do we connect Chicagoans to those existing federal programs, so that way those dollars are going into community. The second is institutional procurement, so thinking about how are we leveraging institutions' dollars that they spend already to support our food system in a way with values that we envision Chicago kind of moving towards. The third is an urban agriculture work group. So that's thinking about how do we reduce barriers for growers here in the city so that way we can produce food more locally. And then the final is supporting BIPOC food businesses with a focus on access to capital. I see people frantically writing, this is all on a website. Do not worry, it's available to you. And I think in the last panel, there was this kind of conversation around community-driven solutions and bringing dollars back to the community. And I think there's a few really important things to elevate, right? A lot of times people ask me about this work and think about it as what are you doing for diabetes? What are you doing for hypertension? And this brilliant woman next to me always grounds me in this, and I'm a dietitian by training. Food is prevention, and food is a fundamental human right, and as a human being, you should have choice, right? So this is not just saying healthy foods only, it is all foods and having equitable access to all foods so you can have the liberty to choose. The other piece is really making sure community is at the center of doing that work. And so an example of that is Roger and Erica are examples of some of the colleagues who've been really pushing for a business license for growers here in the city, I think for over 10 years, which way predates me. And recently we were able to work with growers to develop what that business license would look like, and it passed through City Council recently. It's a different way of working that centers community voice in that process, where things aren't happening to community, but that they are part of shaping the policy moving forward. So that's a little bit of what I'm doing.
And I'm glad you brought up the community. So maybe just reflect a little bit more about how community is involved and how community was not as involved in the past.
Yeah, so anybody who has lived in Chicago for a while knows that maybe departments aren't even talking to each other, so there might be different initiatives in different city departments that aren't working synergistically. And then if you do have like the bat phone and can call someone in one of those departments, you can know what's going on. But if you don't have that connectivity, it can be really hard to understand when dollars are coming out the door or other things like that. Our working groups, there are over 80 people participating in working groups representing both city departments and sister agencies, but also community organizations. So the idea of having a seat at the table, and obviously it's not perfect, and there's a lot more opportunity to include community voice, but there's an opportunity for folks to be a part of shaping policy or providing feedback on things coming down the pipeline, or for me to update, hey, there's a holdup here, it's not gonna go to city council this month, it's going next month, in a very transparent way, is a new way of working.
Ertharin, any thoughts on what the city is doing, and then take us more broadly about what how government and private groups can work together?
Well, of course, I support Ruby and what the city's doing because I sit on her committee. So, her committee for retail food. But I think that what the city of Chicago is doing is looking very clearly, not just at the programs and projects that are necessary, but how do we build businesses? How do we build grocery stores that are sustainable and durable in our community that can provide access to nutritious food? When we talk about, you heard the term food deserts, they're not food deserts. There's a lot of food in these communities. They're grocery deserts. They don't have the access to affordable, nutritious food that they can purchase through retail grocers as every other community does. But the challenge of food deserts is one that is not just in inner cities, it's in urban areas, it's in rural areas, it's in I was just out in North Dakota when you look at what's happening with Native Americans and their access to grocery retail. So this is a problem across our country that we need a different kind of box. The box that the traditional retail food box that we're witnessing close in communities here in Chicago and other parts of the country are failing because the revenue that they make per square foot does not exceed the cost of operating that store. How do we change that model and build grocery stores that can provide affordable, nutritious food at a price that the consumer can afford, but that also can sustain the grocer, and then scale it up and make it viable? But that will require us bringing capital into communities where capital historically has not flowed. And that means that things like, and it's not just government capital, we can use government capital and philanthropic capital to catalyze private sector capital and build a capital stack that not just, I love all the programs that we have, but what if we had businesses that were thriving, that were employing people, that were building wealth in the community? And so building those enterprises that can then not just provide that support, but also provide that income, and maybe a second store, and a third store, and a fourth store, because it's a model that works. So that's part of what we are hoping to do here in Chicago and in other parts of the country, but it's not just about retail food. We talk about the entire food system. You know there's one black pork processor in the state of Georgia? One. The real money in livestock is in the cuts of beef and selling the pieces and parts, but what farmers are required to do because of how our processing system operates is to sell the whole cow, because they have no regional and local processing. What if we could automate and scale up Black, brown, and women-owned processors across the country? And I found that one black processor, and he is actually doing direct-to-delivery. And we're looking at direct-to-consumer delivery, and we're looking at how do we invest in him so he can deliver more here in the city of Chicago. So what you have is a grocery store in your community where you can buy. You have access to processors across the country who you can buy from. What about storage, logistics? Those companies don't exist. Do you know the food system globally is a $25 trillion a year business? We need yes, we need the programs, but let's scale up the opportunity and business that builds community wealth and opportunity. And those children who haven't seen the city of Chicago, let's give them the hope that they need because they have the access to not just the food, but the economic opportunity that provides for them the ability to see beyond their situation today to a more prosperous tomorrow.
Just one follow-up to, you were talking about food as health rather than food as medicine. Explain that, yeah.
I got carried away, y'all, I'm sorry. What I really wanted to talk to you about today is, you made me get carried away when we started talking about grocery stores.
My bad.
You're bad. But seriously, in the United States, we don't have a health care system. We have a sick care system. And we're now embracing that system of sick care and treating disease by making food as medicine. Yes, food is medicine, that's a great way of doing it, but what about food as health? What about making food, diverse diets, affordable and available, and building the consumer demand that is necessary for the consumption of adequate amounts of a diverse, healthy diet to avoid the onset of disease? So food is health. And so, yes, investing in food is medicine, but investing in supporting the policies that are necessary to incentivize consumer demand and to incentivize the investment of capital into the businesses that we've been discussing here that will make food affordable and available to every American wherever you live before the onset of disease. That's food as health. So if you do get a diet-related disease, diabetes or certain forms of cancer or hypertension, yes, food is health. But making sure every child wants and has access to an apple before the onset of diet-related disease. That's food is health. And that's what we should be working towards. That's the difference.
That's a good... Well, that's a good pivot to Laura and the FDA. Tell us what the FDA is doing.
Yeah, happy to, and I think that was a perfect segue in talking about food as health and prevention. That is certainly one of our priorities. So when people think about food and FDA, they often think about the food safety side, but we have tons of initiatives going on in the nutrition space as well, with regulating over 80% of the food supply, including its labeling. And labeling can have a really big influence in terms of empowering consumers, but also encouraging shifts in the overall healthfulness of the food supply. One of the really nice examples we like to share is when we required trans fat to be declared on the nutrition facts label in 2006. We saw a nearly 80% reduction in people's intake of trans fat. And that was the combination of industry reformulation, but also consumers shifting their choices. So as you know, for the national strategy, FDA has a suite of things that we are doing in the labeling space. And there's one in particular that we're working on with front of pack labeling. I'm guessing most people here know what that is, but happy to go into that more. It's really exploded in the use across the world, and there is research that shows that it can really help consumers with identifying healthier foods. You know, as Kat was giving the example earlier about walking down the aisle and seeing just an overwhelming number of choices, that front of pack can be quick signals to provide additional context to consumers and complement the nutrition facts label to identify those healthier choices. And there is, some evidence that shows that it's particularly beneficial for those with lower nutrition literacy. So it's an opportunity to provide nutrition information in a more equitable way. But I do want to talk a little bit too, in terms of our work on sodium, which most of our sodium intake comes from processed, packaged, and prepared foods, not from your salt shaker. And in 2021, FDA issued voluntary sodium reduction targets to help slowly ratchet down the amount of sodium across the food supply. Again, getting to that piece about just an overall healthier options to all people. And we are working very closely with agencies across the federal government to help support implementation of that. USDA and their school meals, the Administration of Community Living and their senior adult nutrition programs. But this also comes back to working with industry and other external partners to make sure that we're successful in those sodium targets and other initiatives that we're working on, so that all choices are healthier.
So I want to return back to Chicago as an example of local government and public-private partnerships. So let's go back 10 years ago this month. Rahm Emanuel said he was going to end grocery deserts. He used the word food deserts, but Ertharin has explained there's a difference. So he's going to do this. As we've talked about, the panel before us talked about, we got Whole Foods, we got Walmart, they're gone. So there's a rethinking, right? I mean, we have to learn from our mistakes of the past, right? So any of you can just jump in and tell me what didn't work, and why do you think the approach now might work better?
Yeah, I think this brilliant woman can say a lot more about what didn't work. But I think we saw a lot of things tried here in Chicago, right? So healthy corner store initiatives. We saw the example of TIF funds being used. We saw lots of things that worked and didn't work. And the reason why the Food Equity Council is taking a step back to think about the whole food system is because it's not just about grocery stores. It's thinking about creating entire food ecosystems that folks can tap into. So I think when we think about communities where there is equitable food access, people have lots of options. It's restaurants, it's corner stores, it's grocery stores. It's a big chain, it's a small chain, right? Like, it's all of these other things. And so you have to really step back and think about how we can shift towards that, and not just maybe bringing in one grocery store into a community and saying, check, that's done. And then I think the last thing I'll add that's important to note is a lot of this is a byproduct of historic disinvestment. And so there is an economic revitalization that has to come with that too. It's not just a food issue, it's a community level issue, it's a neighborhood investment issue. And I think that goes to the piece around private-public partnerships, and not only thinking about what a municipality can do, but what our private investors can do, what philanthropy can do, what local ideas come up from community so that there's a buy-in there.
We have 41 million people in the United States who can't afford a diverse diet on a daily basis. And diverse diets, I'm all about indulgent foods. You should have indulgent foods, but not in the center of your plate. And so people should have in their community places where they can purchase diverse foods. The challenge that we have is creating those places that we've talked about, but also driving that consumer demand. Because building a store alone doesn't necessarily change consumer consumption patterns. The affluent in the United States only consume about between 20 and 25% more produce than the poor. We have a problem with what we all eat in this country. And so behavior change, consumer demand, awareness must become part of building thriving grocery stores in our communities that will ensure the access to affordable, nutritious food. But without changing behavior, we'll build a store and they'll close because people cherry pick. They buy what's on sale, they buy what they can afford, and again, we're back to those same issues. So it's a holistic answer that is required. And this is where you get into government as well, because I'm not going to let FDA and USDA off the hook, because we must increase SNAP benefits. And we must increase the Double Up Bucks program. We have seen where when you incentivize the purchase of nutritious food, people consume more. Surprise, surprise. And so it's a combination of that private investment, that public policy, that as well as public support for a capital stack that can ensure that we move capital in places that have been historically disinvested in, and to entrepreneurs who have been historically left out of the finance picture. That's how we make a difference.
Yeah, I can just add on. I mean, hold us accountable. We, as the federal government, obviously recognize the need for the holistic approach, and that's really where the heart of the national strategy comes from. But I think that, this administration is also very focused on making sure that we are doing more community member engagement. Sorry, I think my mic is coming in and out. We can try switching. So that was one thing that the White House did an incredible job of during the build-up to the White House conference and informing the national strategy, was making sure that they were hearing from community members and individuals who are experiencing hunger and diet-related diseases, and that's something we are very focused on at FDA too, so that we are making sure that the policies that we are developing are going to be effective. And so that's something very much as we go through all of the actions that we have in the strategy, is that we are making sure that we're talking to community members to get the honest feedback in terms of what we can be doing better.
I would be remiss if I didn't talk about an outcome of the White House conference when we talk about private sector engagement. One of the outcomes was FSF, my organization, worked with S2G to create the Food, Nutrition, Hunger Investors Coalition. We were able to bring 30 investors to committing to catalyzing $3 billion in capital to invest in businesses that can support increased access to nutritious food. And we are now at 35 countries and $3.5 billion on the platform. The goal is to ensure that not only do they invest in businesses that VC would traditionally invest in, but how do we expand the portfolio of companies that can provide more nutritious access to the communities that we're talking about here today. So keep an eye out, but that would not have happened but for the White House's conference, that we were able to get these CEOs to come to the table and make this commitment.
Ertharin, you mentioned incenting people to eat healthy. Can you give me an example? I mean, how do you do that?
Well, I alluded to this, one example, and I'll go back to it again, and that is the Double a Bucks program. The program that if I'm a SNAP beneficiary, for every dollar that I spend on fruits and vegetables, it's matched by another dollar. And USDA did a review of this program in 2014 and found a 26% increase in the consumption of fruits and vegetables as a result of this program. But every year the program runs out of money because there's not enough money set aside in the budget to support the demand. The other piece that we need is we need to ensure that we are providing those incentives, yes, but information. Most people, and I heard the young man from My Block, My Hood say, when you know better, you do better. Too many of us don't know what a nutritious diet looks like. And so building that demand amongst community is also quite important through education.
We're almost out of time. Ruby, real quick, anything coming up? I think when we first talked, I asked any wins, in the last 2 years in terms of what the city is doing, and I think there's some funding opportunities coming up.
Yeah, so in the Chicago Recovery Plan, we had dollars allocated to food equity. There are two big projects for that. The first one is the Community Growers Program, which I'm super excited. A lot of folks in this room have been pushing for it. That's $2 million to go towards local growers here in Chicago, so existing farms, and providing kind of funding for capacity building projects, and then to support at least 10 new sites on vacant lots throughout the city. So the first round of awardees were announced, and I think there should be another round of applications coming out soon. And then the other piece that's really exciting and kind of goes back to this investment in community-driven solutions, thinking about entrepreneurs and acknowledging that a lot of times people of color have been forgotten or don't have access to capital in a meaningful way, I think we're fine. Is that there will be an RFP released for a good food fund where we'll be identifying an administrator to manage this good food fund that'll support food entrepreneurs, and then also identifying food incubators, really focusing on early stage entrepreneurs, so not accelerators, but kind of, I have an idea and I don't know how to get it across the finish line. And so both of those should be released this month, and those will find the administrators, and then money should be going to community in 2024.
Let me very quickly say, it is so important that you have that government capital to catalyze capital stacks so that we can begin to prove that you can make an investment in a business that will deliver impact, a nutrition impact, and a financial return. Then we'll begin to see capital flow. Capital flows where there's success. We need to demonstrate that success.
Well, thank you to this great panel, and let's give them a round of applause. And we could go another hour, but you know.
A bigger round of applause for these three powerful leaders, please. Thank you. Amazing, amazing panel.
Okay.
I want to thank all of them. I want to echo what Ertharin said, that we need communities that not only give access to food and diverse food, but access to hope. Hope is so important when we're having these conversations. I also want to say that before we continue, that Food Tank's work would not be possible without our grassroots members. Many of you in this room support Food Tank. Many of you watching online support Food Tank. We could not have events like these. We could not have original content on foodtank.com. We could not have our podcast or anything else that we do if we did not have grassroots support. So I want to thank you all from the bottom of my heart and from Bernie's heart for supporting Food Tank over the years. It does mean the world to us.